want to ask about the India situation from more of a selfish point of view. I mean, Doctor, clearly it's a tragic situation. We continue to get horrible numbers, 350,000, I think, the amount of new cases yesterday. But does the developed world realize how much of a problem that could be for them if it comes back around in the form of reinfections with new variations?
Well, I think there are multiple ways that what's going on in India threatens the world. The first is just the sheer amount of suffering and catastrophe that's happening in India, and all the different ways that could affect families in India, their families all over the world, as well as the economy. And then you do have this biological concern that, if we allow the virus just to spread unimpeded all across the world, it will continue changing and destabilize potentially other countries that have it more under control. So it's a really serious problem. We're a year into this, and we're really only now seeing the full, fearsome potential of this virus, and we have to really jump in to help India.
In terms of what we can do, I imagine they just need so much, from hospital equipment to vaccines. They're going to need long-term healthcare help as well. If so many people get COVID, then I guess it's a smaller percentage that get long COVID, but that's going to be a massive number when you look at this population. What can be done? What needs to be done?
Well, it's also important to realize India has an enormous pharmaceutical industry and an enormous vaccine industry, and the world's really been counting on them to make vaccines for many countries across continents. So, really making sure that that industry can stand up and produce a lot of safe and effective vaccine is just incredibly important to the entire globe. And then you have the urgent issues: oxygen, like you said, protective equipment for healthcare workers, staff even. I mean, there are all sorts of supplies that are necessary to help with the surge in cases. So this is really going to be a very challenging time, because you remember that this virus can spread exponentially. And so what you're seeing today, it could be double in the next week. And that's the kind of growth that just makes everybody, realize how much is at stake.
In terms of what we're seeing in the U.S. and here in Europe, things seem to be going much better. Well, certainly in the U.K., they've given one shot to at least half the population. The U.S., well on its way there. And today, Ursula von der Leyen in Brussels was saying, at some point, U.S. visitors are going to be able to come back here if they're vaccinated. How does the vaccine rollout go forward after pretty much everybody who's wanted a vaccine has gotten it now?
So I think you have to think about three groups of people. There are the people who really wanted a vaccine. They were the ones banging on the pharmacy door. And in the United States, those people, by and large, are now getting vaccinated. And if they haven't been fully vaccinated, they know when their appointment is. Then there's a second group that were in the wait and see group. And they may not be banging on the pharmacy door, but they're interested, and you have to find them, answer their questions, and they'll get vaccinated. I think that's really the main stage that we're talking about in the United States, and that may be 30% of the population. There are a lot of people there, and that isn't as easy as just opening a football stadium and vaccinating everyone who shows up. You've really got to go out to communities, you've got to answer people's questions, you got to do mobile vaccination, and that's going to be the nature of the effort.